Talk Mississippi. We go from the lieutenant governor to the state medical officer. Dr. Dan Edney joins us this morning. Dr. Dan, hello to you. Hope you're having a great summer so far.
Yes. Good morning, Richard. Glad to be with you.
Why is it that it stinks so much worse to get sick in the summer than it does in the winter? That's a very technical medical question. Okay.
Too dang hot. Too hot to be sick.
That's as good an answer as any. Appreciate your time. What's top of the list right now? What's the thing that you are most focused on at the State Department of Health as we do make this transition from spring into summer and it seems like the concerns change a little bit seasonally.
They do for us at a population level. As we get towards the fall, we'll be gearing back up for respiratory illness season. But during the summer, we deal with a lot of gastrointestinal outbreak issues, norovirus, which can happen a lot in congregate settings like nursing homes, but also casinos and big buffet areas. We have an active salmonella outbreak related to a restaurant, and that kind of stuff just tends to happen a lot more in the summer. Our really top tier project right now, our signature effort right now, is our fourth statewide system of care that's entitled the Obstetrical System of Care, which is designed to reduce our maternal infant mortality rate with our high-risk moms and babies. And Richard, once we get this system designed and in place, we will be the only state that has 4 statewide systems: trauma, heart attack, stroke, and now high-risk OB.
You mentioned trauma, and I guess the trauma hospital of record in the state is UMMC. We see this incredible growth that's happening and a widening footprint for UMMC. What does that mean for communities outside of Jackson?
Well, I think many times smaller rural community hospitals that are struggling to make margin are looking for partners like UMC. If you also notice, the Baptist Medical Center footprint is enlarging with Oktibbeha County being purchased. The Ochsner footprint, it has enlarged. So that's really kind of the model for many of the smaller independent hospitals that just aren't making it, or to find health system partners to come in and either partner with them or either acquire them. And UMC is a substantial healthcare system. They're an academic healthcare system, but a healthcare system nonetheless.
Is that acquisition of smaller hospitals financially beneficial for the bigger hospitals, or is it just they have the ability to kind of spread the losses farther and wider and so they can handle it?
Well, it better be financially advantageous, or we have had some acquisitions that went south in the state. But usually systems like I just named have exactly the capacity you're talking about. Their spreadsheets can take on that extra debt and manage that debt better. And really importantly, you'll understand this, and Lance will understand it from the financial background. You've got to have access to capital to make it in healthcare. And the smaller county independent hospitals really are losing access to capital that they used to have. The larger healthcare systems are able to. I mean, if you're not making margin, if you're not in the black with your margins with healthcare, you're not going to have the ability to finance new projects or to service debt, the way that you need to. So the larger systems are able to do that.
Lenders are just looking at it as too high risk of an investment for them?
Yes. It's the smaller you get, especially we have several hospitals with chronic debt, then that worries them even more. And knowing that the challenges with healthcare financing and infrastructure management are becoming more complicated, not less so. It is, the venture capitalists are coming into healthcare in a big way, but they're being really choosy.
Visiting with Dr. Dan Edney, State Health Officer. Back in the winter, bird flu popped up and became a very real thing. And, people talked a lot about egg prices based on who was in the Oval Office. It could be that bird flu actually had a larger role in the price of eggs.
Yeah.
Is there any concern about that on the human population side? Or is that something you're looking at in the state health department? Or is that completely a Department of Agriculture issue?
It's a great partnership, actually, Richard, between us, the Agriculture Commission, but also the Board of Animal Health. Dr. Watson, who's the state veterinarian, is doing a lot of leadership in this area. And really, with the bird flu situation, we're serving in support. We're doing a lot of monitoring and testing. The Board of Animal Health is managing the flocks, and they've had to order the destruction, of several flocks in the state, but nothing recently. And it really has calmed down. And what we're watching is we know that this virus has the ability to jump from birds into other mammals, definitely dairy cattle, which we worry about, but also we've had human transmission cases. But so far, it's not mutating in a way that worries us, and we've not had to intervene. And we've had no human bird cases in Mississippi. And right now, as I understand it, all the flocks are clear. But, when you have to sacrifice an entire flock, to keep it from propagating, that drives chicken prices up and definitely drives egg prices up.
There are parts of the country that don't have to deal with this as much as we do. But if you live in Mississippi and you spend any time outdoors, there is a really good chance that at some point you are going to end up with a tick, either crawling or embedded.
Yep.
I got a good friend that has alpha-gal. It was a tick bite that he got, and all of a sudden he can't eat meat from hoofed animals anymore.
Right.
And,
Isn't it crazy?
Creates a terrible reaction if that's the case. Is this new? I mean, is this something in the last decade that we're seeing, or is this something that has been around for a long time and we just didn't recognize it?
It's been around for a long time, better understood now, which is common in medicine. A lot of times when you see an increase in prevalence of things, a lot of times it's because medicine has better diagnostics and has figured it out, and we're able to identify more cases. But, tick bites are really, dangerous in a lot of ways. Don't forget Lyme disease.
Sure.
But very importantly, Rocky Mountain spotted fever. We have many tick-borne illnesses. So, I preach it. If you have kids that playing outside in the summertime, tick checks twice a day. Check them in the morning, check them in the evening, get them off. A tick bite itself is nothing to panic over, but when a tick attaches and engorges for a while, then they're able to transmit the pathogens that they have, and especially if you have a tick bite that gets that has this strange rash coming out from it, especially if it looks like a bullseye target, that's more high risk of being Lyme disease and need to get attention for it. But
I don't know that there's any way to avoid them. I mean, you can spend 10 minutes outside or 10 hours outside, and you're just as likely to get one. Yeah,
ticks or chiggers, either one. But it's it's part of being kids in Mississippi. Let them play safely.
That's right.
I'm more worried about them getting dehydrated than about the tick bites. But do pay attention to it. I tell you the other thing when talking about bird flu. We have had our first case of West Nile, and we had a rough year with West Nile disease last year, and we had more deaths and more cases. So just remember, if you see a sick bird in your yard, leave them alone. If you find a dead bird in the yard, put gloves on, use a shovel to dispose of them. Don't pick it up. You can get, it could give you bird flu, or it could give you West Nile. and just protect yourself from those mosquitoes.
There you go. Be smart. Dr. Dan Edney, State Health Officer with Mississippi State Department of Health. Thanks as always for your time. Look forward to visiting soon.
Thank you. Always.
Stay safe out there. Mornings with Richard Cross, SuperTalk, Mississippi.